Well, in the aftermath of the deadly mass shootings, parents, guardians, and educators may be wondering how to talk up with their children about the tragedies that have hit so close to home. Dr. Hilit Kletter with the Stanford Children's Health joins us right now. And Doctor, some advice that you can give us first. What is the most important thing for parents to ask or talk about when speaking with their children about these kinds of scenes that they're going to see all over the news?
Sure. I think it's important for parents to set aside time to have these conversations. With younger children, it's going to be very important to focus on concrete information and primarily to provide reassurance around their safety. For older children, you can start the conversation by finding out what they've already heard, what they think about it, and what they know. Stick to facts as much as you can. It's okay if you don't have all the answers, but be truthful. Also, gently correct any misconceptions that they might have. And it's really important to allow children to talk openly about their experiences and to be able to express their emotions.
And what signs of trauma and anxiety should parents look for in their children when trying to cope with what they're seeing and hearing?
Yeah, some of the things that you might notice that would indicate kind of red flags for concern is with younger children, if they become more clingy or having more frequent temper tantrums. With school-age children, they might start having a lot of physical complaints like stomach aches, headaches, that sort of thing. With adolescents might become more withdrawn or have difficulty focusing. Another really common sign is any difficulty with sleep. And if these things persist for a week or longer, we would really recommend seeking consultation with a mental health professional.
And how does social media play a role in a child's understanding of what had happened? How much social media should our children be taking in during these times?
I think it's important to limit both our own exposure as well as our children's, especially with the wealth of different avenues for information these days, which on the one hand is great to keep us informed. But at the same time, it can, with the easier accessibility to so many forms of information, it can actually increase the risk for post-traumatic symptoms. So it's important to limit to one trusted source, and definitely for parents to screen what their child is watching, listening, reading.
And just bouncing off that whole idea of social media, and you already touched upon this, how do parents talk to their children about so much information and sometimes misinformation that they might be seeing on social media?
Yeah, I think, again, it depends on the age of the child, but with younger children, it might be very concrete in terms of what they have access to, right? And putting parental screens. With older children, it's teaching them how to judge whether what they're reading is correct or not, right? Kind of like, how do we discern the facts? And what are trusted sources of information? And also inviting them and opening up the discussion so that you can vet out what they're thinking and what they know and whether it's accurate.
Yeah, it's just so tough to have these conversations, but so important to also have them. Thank you very much, Dr. Kletter, for your time.
Thank you for having me.